Several patients every day will arrive with a presumed diagnosis or suspected diagnosis of heart attack.
It was scary at first, not knowing that they said I had a heart failure.
A lot of people don't even know the symptoms of a heart attack. In fact, only about 27% know like they have pain and then they need to see somebody.
He found it, and if he hadn't found it, I might have been 6 feet under right now.
What makes the cardiothoracic surgery program at Washington Hospital unique is that the patients in the community can receive the kind of care that would have received otherwise at the major medical center here in their own community. Complex cardiac and vascular procedures and operations can be done at Washington Hospital with a great degree of safety and efficacy and a great outcome for our patients, which is actually more convenient for them as well, receive their care here at Washington Hospital. Starting in 2016, Washington Hospital program has decided to make a strategic partnership with the University of California, San Francisco. So both my colleague, Dr. Teng Li, and myself are professors and faculty at the University of California, San Francisco.
So we not just take care of patients that come into the emergency room, we take care of patients that come from surrounding smaller scale hospitals. As you know, the outcomes are very related to timing of intervention, and the earlier we can intervene on certain disease process, the better the outcomes generally. We are pretty comprehensive cardiac service, so we pretty much do all kinds of cardiac surgery here. We do regular bypass surgery, we do valve replacement, we also do aneurysm surgery.
The sooner we can get the patients to the hospital, the sooner they can get the treatment that they need to restore blood flow, whether it is in the brain, in the case of a stroke, or the heart, in the case of a heart attack. Hi, hello, Mr. Dillon.
Hi, Dr. Peng.
How are you?
Nice.
Good to see you.
Nice to
How
see you
feeling?
again.
Good to see you.
Washington Hospital has a very good cardiac surgery. I mean, they have very good doctors. My wife used to call them the power team. They gave me a pillow heart after the surgery, so I just had the doctors sign each one of them as a memory to me, you know, what I've gone through.
He had open heart surgery. He had mitral repair, tricuspid repair, cabbage procedure, and a MACE procedure.
Dr. Beggy was kind of like a calming voice before the surgery. He was like an angel. Gave me sort of like a second life. Not really a second, maybe a third life, because I went through, during the procedure, I went through 3 cardiac arrests.
My husband is very thankful for everybody in Washington Hospital. I think everybody is really amazing here. They take good care of, of you and make you feel at home. Like my husband says, this is his second home.
Glad to be alive. Life is still beautiful.
A lot of people don't even know the symptoms of a heart attack because some of the symptoms of a heart attack or cardiac issue are not just pain in the chest. I mean, they can be just some nausea, they can have abdominal discomfort, jaw pain, arm pain, back pain, and things that people don't particularly associate with the heart itself because the body is sort of intimately related to each other, all the organs, and sometimes a lot of the symptoms are not that clear-cut.
Hi, how are you doing?
Pretty good.
You doing all right?
I'm doing okay.
Okay, everything's going good?
Yes.
Okay, good. Let me take a
I went to see a retinal specialist, and he checked out my eyes, and he found a blockage in my eye, and thought that I better get this thing checked out, and found out that my aortic valve was very stenotic and calcified. Dr. Lee was very good. He was very helpful in just getting me mentally prepared for the operation. So I had a bypass surgery done along with the aortic valve, and everything came out okay. It was fine. I feel great right now. It was very, very good. The personnel here are very excellent. They were always very attentive. I never had any problems with any of them. They were just great.
There are actually quite a few things that the patients can do to reduce the risk of heart disease and stroke. Cessation of smoking is very important. That's one risk factor that we can reduce. Control of their cholesterol, adjustment of the diet, regular daily activity, physical activity and exercise, and maintaining a healthy weight is very important. And perhaps managing our stress, our daily stresses are also important, that we can reduce the risk of stroke and heart disease by those things that anybody can do to reduce the risk. Fortunately, the great majority of our patients do very well. And once they do well and they can return to their home and to their normal function, and we'll see them afterwards in follow-up, it's very rewarding for us.
Learn more about heart health at BayAreaHealthierTogether.com.